Good morning. We are live. I'm Dr. Smandika from the IIP Digital Media team. I will be the host for today's webinar on exercises of first and second trimester, a practical approach, with resource person Dr. Sudhini Borkar, being organized by Indian Association of Physiotherapists Women's Cell Goa. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IP Digital Media team consists of a group of physios who handle Zoom platform, webinar live streaming, and IP profiles on social media platforms like Facebook, Instagram, Twitter, LinkedIn, and YouTube. Follow IIP profiles on these social media to receive notifications for our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drives, and to know more about recent updates on physiotherapy. Subscribe to IAP YouTube channel for notifications of our live webinars. In the playlist section of this channel, webinars are segregated into various platforms on topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women's health, research, cancer rehab, etc. for their easy access. The social media links will be shared shortly in the chat. With this, I would like to start the webinar. Dr. Riddhi would be doing introduction for today's webinar of Dr. Sudhini. We have Dr. Pooja who will be doing the vote of thanks, as well as Dr. Rashmi who will be doing for us the question and answer. With this, Dr. Riddhi, can you please start?
Thank you, Dr. Smanika. I, Dr. Riddhi Sampath, would heartily welcome Dr. Sudhini Borkar on the webinar of a practical approach on the first and the second trimester exercises. And Yeah, so I would like to welcome Dr. Sudhini Borkar on the first and the second trimester exercises practical approach. She has done her MPT in OBG and pelvic floor therapist consulting physiotherapist at Savia Women's Health and Wellness Center, Panjim, Goa. She is a pre and a postnatal fitness expert. She is also teaching labor and a birth supporter. She is a former assistant professor at Nitte Institute of Physiotherapy, Mangalore. She is also a former senior women's health physiotherapist at Aquatic Therapy, Mumbai. I would appreciate if all the participants can put their questions at the chat box and we would be taking it up after the webinar. Thank you. Over to
Thank
Dr.
you.
Sudhini Purkar. Yeah.
Thank you so much, Dr. Smarnika, Dr. Reddy, for this warm introduction. And a very pleasant good morning to all my lovely attendees here and my fellow physios. First of all, I would like to extend greetings of this auspicious day today. So happy Mahashivratri to one and all. And let's start with our today's discussion, which is going to be on trimester, first and second trimester exercises only, and we're going to discuss a lot about practical approach here. Okay. Is the screen visible? Can someone give me a heads up?
Yes.
Yes, right. Thank you. Okay. So today we're going to discuss on the first and the second trimester exercises, and it's going to be a complete practical approach. Okay. I'm sure you must have heard, attended, understood a lot of webinars or workshops which talk about pregnancy. What are the different changes that you see? What a mother should expect. Okay. But today we will see what are the exercises or what we as physios can do for our mothers in the first and in the second trimesters. Okay. So the following is going to be the content of my discussion. All right. We're going to talk about the benefits. We'll see what are the different guidelines which are there. Okay. And what are the exercises, when to stop, when to resume. And then finally, I'll be demonstrating the exercises to you here in a proper flow of warm up, the main strengthening exercise, and then the cool down. Okay. So let's dive into the topic. Pregnancy. We all know it's a beautiful journey or it's a beautiful phase in a woman's health where she has to basically be in the process of developing her fetus in a 40 weeks process. Okay. It's a 40 weeks process extending to 270 days, or to put it up in months, it is 9 months. Okay. So 40 weeks, 270 days, or 9 months of this beautiful journey of beginning from the first day of the women's last menstrual cycle to the 9 months. Okay. And we divide it into 3 trimesters where each is going to be of 3 months each. Okay. Now, pregnancy is a different journey for everyone. All right. Like for some, it would be whatever, like, some might experience that my journey was very smooth, or they some would come up and tell you that my 9 months went very well. I did all my exercises. I was given a green signal to do any form of exercises by the doctor. Okay. But for some, it might be different. Okay. Like for some, doctors might advise them to go for a bed rest in the first 1-2 months only because of their condition. Okay. So today what we're going to talk is the exercise prescription and the practical approach for all healthy mothers. Okay. I'm not going to talk anything about the high risk mothers because that's a different vertical altogether. We're going to only focus on mothers who are healthy and who are given a green signal by the OBS to go ahead and do their exercises. Okay, fine. Uh, Okay, so the 3 trimesters, we know the first 3 months come in the first trimester, the fourth, fifth, sixth in the second, and the last three, seventh, eighth, ninth come up in the third. Okay, to put it up in weeks, it's 0 to 12 or 1 to 13 weeks if you started with the week 1. Then you have your the next trimester, the next second trimester from 14 to 27, and the last trimester from 28 to 40. Okay, now what happens? If you can see these images here, okay, the first trimester is all about uh, multiplying of the cells, okay, multiplying or activities which are happening at the mitochondrial level, like a lot of multiplications of cell. There is meiosis, mitosis, gene manipulation, mutation which happens. So this phase is called as the germinal phase, okay, or this year is called as the germinal, where we start our pregnancy in form of a small mulberry. Okay, exactly as a mulberry is the embryo, the fertilized embryo, and from that small mulberry, the end product is a 2.5 or plus kg healthy baby that we produce. So you can just imagine the amount of energy expenditure the woman does. Okay, while she does all her daily activities, while she does even her work and balances out the other things. So it's a heads off to all the mothers out there because it's incredible. It's a beautiful journey that they go through. Okay. Now the second phase is called as the embryonic phase. Okay. Whatever multiplications have been happened in the first 3 months are going to develop into limbs, heart, organs, all the organs start developing in the second trimester. So by the end of the second trimester, you have a baby which is formed, okay, and in the third trimester, which is called as the growth and the developmental phase, the baby just grows with whatever product is being formed in the second trimester. Okay, so from this only you can understand the energy levels. Okay, because something is happening at a very mitochondrial and at a very base level, the energy here that the mother gives off is extreme. Okay, like she might feel fatigued, she might come up to you and say, no, today I'm not interested in the exercises. Fair enough, let's take it her way because something is happening down at this level. Okay, in the second trimester is a happy phase. Okay, it's called as the honeymoon phase of the pregnancy, where your energy reserves are getting better. Okay, you get the strength, you feel motivated, you feel like doing all the exercises. Okay, and you basically accept all these hormonal changes that have already happened in the body. Okay, and third trimester is the phase where you start preparing and welcoming your baby. Okay, so let's see what we can do in the first 2 trimesters. Now, a very common question: why should I exercise during pregnancy? Okay, or what is the benefit that I'm going to get with exercise? My mothers, my grandmothers, even they delivered, but they never exercised. They did it without exercising. Okay, so how I exercise is going to help me in my pregnancy. Okay, there are exercises have benefited everyone from the mother till the fetus, everyone. Okay, so first and foremost is the physical well-being. It is seen in research as well as it is proven that when a mother who's into active who's having a very active lifestyle or who's into exercises, okay, in some or the other form, have lesser chances of getting gestational diabetes mellitus in the second trimester, or having hypertension issues in the second trimester, or any kind of heart disease in the second trimester. Okay, because all this starts picking up from your second trimester majorly. Okay, again, it maintains your flexibility, so your body is ready to go and undergo the changes that to welcome the baby. Whatever changes you need, the body is all ready for that. Okay, your strength is better. Okay, so you can sustain your pregnancy without any aches and pains. Okay, when you exercise, there's a lot of endorphins that get released in the body. Okay. And with that, it only adds to being happy. Endorphins are basically happy hormones. You feel very happy, you feel very nice when you exercise. Maybe only 5-10 minutes of a walk, okay, but there'll be a sudden change that will happen in your mood. Okay. Sleep quality gets better, of course, when you exercise. You understand about the various postures, you understand about the various postural changes that you have to do when you're sleeping, and your sleep quality also gets better. Okay. More importantly, and very much important, is the core muscle in the pelvic floor. Okay. The four core muscles: transverse abdominis, pelvic floor muscle, multifidus, and the diaphragm. These four undergo the massive change in our 9 months. Okay. So when you have them under your control, when you have them well balanced or well strengthened, okay, you will undergo changes. But the end product, what you have, like a drastic loss of strength in these muscles, will be better. Okay, so once you exercise in pregnancy, your core strength remains good. Okay, at the end of the pregnancy. All right. Then coming to the labor and delivery, which is the end product of our pregnancy, where we want to deliver. We are all looking forward to undergo a natural labor or whatever. So, this will help us to go in there. Okay. Benefits of the fetus is what? Because of exercising, there is good oxygen transfer that happens between the placenta and the mother. Okay, we give them a lot of aerobic exercises, we give full focus on breathing exercises, and this helps to exchange good oxygen between the placenta and the baby. Okay, so that itself is good for the baby, for his weight gain, for his cardiovascular system, for his neurodevelopmental growth. All right. And it is seen that the mothers who are into active exercises have a longer gestation age, as in the chances of premature delivery or premature labor is lesser. Okay. Similarly, your PROM, that's premature rupture of the membrane. PROM means that premature rupture of the membrane, that is prevented. Okay, so you basically don't undergo a early labor. All right. Uh, Sorry, I should have explained. Now coming to what exercises, what is the prescription, how many days to do, like basically to understand the intensity, duration, frequency, and the time. Okay. So there were 2 or 3 kind of guidelines which were there, which spoke saying that yes, women can in pregnancy can do exercises. Okay. Two of them is ACOG, American College of Obstetric and Gynecology, American College of Sports Medicine. There is the Federal Physical Activity Guidelines. So there are 2 or 3 guidelines which are out there which promote exercises in pregnancy. Okay. So what does the ACOG say? That the intensity, like how much you have to take the exercises for, they say that you can go up to 140 beats per minute. Okay. Whereas the ACSM says that you can keep it around 12 to 14 on a box scale, which means that she should be able to talk comfortably to you while she's exercising. So that is what it means, 12 to 14. Okay. Duration, ACOG said let's keep it to only 15 minutes, but ACSM gave that it can go up to 15 to 30 minutes. Okay. Frequency, that it was not recommended in the guidelines given by ACOG, but ACSM said that you can do the exercises for 3 to 5 times in a week. Okay. Coming to the type, what type of exercises should I do? ACOG said aerobic exercises are going to be good, whereas ACSM recommended any kind of non-weight bearing or weight bearing exercise. Okay. So studying all these 3 guidelines which are out there, there was one common protocol which was set out, which said that any pregnant woman who is healthy, okay, without any comorbidities, a healthy pregnant woman can engage into 150 minutes of moderate exercises for 3 to 5 days in a week. So even if you conduct like half an hour for 3 days, it's going to be enough. It's going to make up for our 150 minutes for a week. Okay, so that's the protocol that everyone follow. Okay, but again, coming here, like I told you, every pregnancy is different. Okay, one mom might be able to catch up to this pace of doing 150 minutes in a week. Okay, but there's another one who is not able to. All right, so this is the standard protocol which is there, but listen to your mothers, listen to your body, okay, and let the exercises go from there. So start slow and start very slowly and progress as your body lets you do. Okay, fine. Now, what are the exercises that we should do in the first trimester, and what are the exercises we should do in the second trimester? Okay, it's simple. It's the best thing to do when you're deciding what exercises to focus on is to follow the principle of specificity. Okay, be specific. All right. When I mean to say be specific, I want to emphasize that be trimester specific. Okay. Like for example, in trimester one, all right, my goal shouldn't be to stretch the pelvic floor or to work on a lot of the pelvic mobility. Okay. That I can keep for the third trimester for my labor preparation. Okay. In trimester one, my mother's energy levels are low. She's on the onset of a nausea. She's not able to, there's a lot of fatigue. She's not able to catch up with the pace. Okay, so working a lot on the stretches on the pelvic floor, working a lot on the pelvic mobility might get her a little tired. That would be a little exhausting. Okay, so let me be specific to my trimester one. Okay, and let me give her exercises which are going to be very less or low in intensity and very less of energy expenditure. Okay, so what should I include? Basic or the best thing that you can tell her is walking. All right. Let her walk for 10 to 15 minutes a day. Enough, more than enough. Okay. She'll be getting up with a lot of morning sickness. There'll be nausea, there's fatigue. I told you there's something happening at the germinal level, and it's very obvious that her energy wouldn't be so much. Okay. So it's fine that she takes it very lightly and do as much as 10 to 15 minutes of walking in a day. More than enough. Wear your proper shoes, go out, prefer outdoor walking, then doing it on the treadmill. Okay. And you can walk in the nature, you breathe, you come across different scenes. That itself is going to make you feel good and happy. All right. So very minimal energy expenditure, and the walking is not to reduce weight. The walking is just to get into the circulation or just to make you feel good. So today, if you're not feeling good or you're fatigued more than yesterday, I'm okay if you don't do exercises today. Okay. So let's take it slowly in the first trimester. The second and the very important one, or I would call this as the basic of every exercise, is your core breathing. Okay, which is the form of a breathing. I'll be demonstrating it to you in my practical session. But core breathing is a type of breathing where you incorporate all the four core muscles and you breathe. All right. So it's just you can do this breathing in different positions, sitting, standing, all fours. You can administer it to her in lying, the crook lying position. Okay. So you can give her this breathing in different positions. Side lying is one more. Okay. And activate the core muscles. Okay. I've used the word activate. I'm not using the word strengthening. That's my goal in the second trimester. Okay. So incorporating only this breathing exercise, we can activate the core muscles. Okay. It seems easy. Somebody might say, oh, I have to only do breathing exercises in my first trimester. No, it's not easy. It's not just inhale and exhale. It's inhale, exhale with pumping of those core muscles. So I'll be demonstrating it to you all in my practical session. Okay. Next is the posture correction. Somebody who is already having a bad posture, okay? Like a mother comes to you in her first trimester and she's having a kyphosis, okay? She's having an anterior pelvic tilt. You know her hips are a little weaker, okay? Like she's not able to her posture generally, like there's a hip hike which is there, okay? So when you know the pre-existing postural changes, try to work on them in this first trimester. Okay, you can give them certain stretches, you can give them basic corrections, you can teach them about the bed mobility, you can teach them about the sitting posture. So all these changes, this is the right time to do it because you need very minimal energy expenditure here. Okay, because if you let it be in the first trimester, the kyphotic posture that she comes to you, if you let it be, it's only going to get worse in the second trimester because the body is going to change. The uterus, which was in the pelvic cavity, is now coming into the abdomen. Okay, it needs more space. There's going to be a lot of alignment changes in the spine. Okay, so it's only going to get more worse. So if this is the right time, let's start working on her posture correction. If you feel they have been anything, if you find her hamstrings are tight, work on them. We would need certain muscles to be flexible, relax. So you can do that. Okay, and try to keep it only mat based. All right. Avoid any kind of vertical loading in this trimester one. Avoid any kind of squatting. Okay. Avoid any kind of excessive hip abduction. Okay. Why is because we in the first trimester we are not sure where the position of the placenta is. Okay. We get to know about the position of the placenta in our second trimester, somewhere around 13 to 18 weeks, where we do our anomaly scan. Okay, that's where we get to know the position of the placenta. We know the cervix length. Okay, we know the amniotic fluid in that scan. Okay, so unfortunately, if the placenta is low in her first trimester and you start giving her exercises of a lot of hip abduction, a lot of squatting, a lot of bearing down, that's only going to worsen it. There's chances that she could have some spotting or there could be a little bleeding. Okay. So the best thing to do is to do the breathing exercise, give her light exercise, light walking exercises. Okay. Postural corrections only with a mat-based protocol, mat exercise protocol. Okay. Where she's in supine or she is in a crook-line position. Okay. Avoid vertical standing, avoid squatting, avoid excessive of hip abduction or excessive stretching of the pelvic floor muscles. Okay. Because we're not sure about the scan. All right. So that's about the trimester one. We're going to see what are the different options that are available in this trimester one in my practical session. Okay. But the goal or the main outline is going to be this. Okay. Now coming to trimester two, like I told you, the energy is getting better. The hormones are going to set in, right? So she'll feel a little more energetic. She'll be a little more enthusiastic. She'll be motivated to do her exercises. Okay. So when she comes to you, you can slightly improve the cardio. She can increase her walking. You can tell her, okay, now you have to be specific to half an hour of walk. Okay. Increase her cardio goals. Increase her cardio challenges. Maybe if she's only doing walking, you can tell her to do swimming. You can tell her to do a static cycle. All right. You can increase this the cardio challenges for her in the second trimester. Okay. Coming to the resistance training, you can start adding weights now to encourage those core muscles. Okay. We have just activated the core muscles in the trimester one. In trimester two, we are adding a dumbbells, we are adding a TheraBench, we are adding a TheraLoop, Pilate balls, physio ball exercises. Get in all your resistance equipment that you have, and you can start training her in this phase. A lot of musculoskeletal complaints will start coming in trimester two. All right, there'll be back pain, pelvic girdle pain, symphysis pubis, there'll be tailbone pain, there'll be varicose, lot of vascular, musculoskeletal, lot of complaints would start coming in trimester two. So make sure you start strengthening them as early as possible in the early months of your trimester two. Okay. Last but not the least, and very important, is teaching her the functional movements. Okay. Always keep your functional tasks in your training program in your trimester two. Okay. Functional movements that she'd be using in her postpartum. Okay. Lifting the baby up. Okay. Twisting. And it's a very common tendency they breastfeed and then they twist and they put the baby down. So what happens when they suddenly twist? There's a back pain, the back sprain that they get, or they have a spasm which comes up. Constant feeding, that posture there gives them the upper back pain. Okay, so functional training with movements of lifting the big car seat, lifting the baby up from down, hinging down to lift up something. Train them functionally. Rotations, okay, train them in this tasks. Okay, so you're basically getting her ready for the postpartum, keeping the functional task that she would be doing in her in the early postpartum phase. All right. Now, coming to the consultation, what all should I check when she comes in for a consultation? Okay, have the consent form with you. Okay, make sure that you take a consent form. It's always safer to have a consent form. Okay, note the gestational age, very important. Note the what week she is in, what month she is in. So noting of the gestational age, type of conception. All right, whether it's a natural conception, whether it's IVF, whether it's IUI, we need to be aware of this. If it's a natural conception, we can safely do all the exercises. If it's IVF or IUI, we need to rule out of certain exercise, or it has to be a strict one-on-one session again. Number of pregnancy, whether it's she's primary-parous, whether she's multi-parous, or whether she's grand-multi-parous. These the time of pregnancy, what times, the first time or the second time is going to give you an idea of the weakness of the muscles. All right. And whether any of the trimesters have been eventful, whether there's been a certain incident which has happened in the first 3 months or the next 3 months which are eventful. Okay. Now coming to the examination, where we as physios do a massive and a really good, change in her pregnancy. Posture alignment, make sure her spine is properly aligned. Okay. Like I told you, check if there's any pre-existing posture deformity, pre-existing back pain, pre-existing discomfort that she has, you can note it down. Okay. Ideally, the weight of your center of gravity should be on your heel when you're not pregnant. Okay. When you're standing, when you're not pregnant, when you're standing, the center of gravity should be on your heel. Okay. But what happens when we are pregnant? The baby, the uterus comes up into the abdomen. Okay. And it starts falling ahead. Okay. It starts going ahead. Okay, because the weight is shifting ahead, our center of gravity from the heel moves to our 4 foot. Okay. Because of that, all the postural changes starts happening. Balance is challenged, right? The pelvis starts going into anterior tilting. Because the pelvis is going into anterior tilting, the whole spine takes the alignment change. You tend to bend down there. Okay. So try working on the abdominal strength, the glute strength to maintain that posture in your first trimester only. All right, fine. Next is the abdominal separation. Now, how do I check abdominal separation when she's come to me when she's pregnant? You can't let her do crunches. Okay. So how would you check for it? All right. So whenever she's sitting, tell her to slightly lean back. Okay. So when she leans back, you'll see if her abdominals are weak or if her abdominals are separated, you will see a coning which happens when she goes back there. All right. So you know there is a pre-existing diastasis or there is a weakness of the abdominal wall. Okay. That's how you check for the abdominal separation when she is pregnant. Okay. Sitting without the back support and slightly leaning back to 45 degrees. If there's a coning which happens, that means there is separation. So you should be aware that you need to work a little more on the abdominal strength. Okay. Coming to flexibility. These muscles are really important. Okay. Psoas major. All right. I would like to show it to you here. Uh, okay. We see the origin of the psoas major. Okay. It starts at T12. All right. And it goes down to our, it starts at the T12 and goes down till our lesser trochanter of the femur. Okay. This muscle is here. All right. Now imagine if this muscle is very tight. Okay. It's very tight on both the sides. Do you think it is going to let my uterus grow well? Okay, something which is very taut on this side as well as very taut on this side. What is going to happen? My uterus is not getting space to move. My uterus is just stuck there. Okay, the chances of the baby also baby's movement also is lower. So chances of bridge position is more in this tight psoas major cases. Okay, the baby always remains in transverse or the baby is in a bridge presentation. The baby going down in cephalic presentation is very lesser. So check for the tightness of the psoas major. All right, you can do it with your Thomas test, the normal Thomas test that we use for the other exercises. You can do it with the same Thomas test. Try to go at the edge of the bed, take the support, go down, and then take the knee to the chest. Okay, adductors, very important. The adductors have their origin at the pubis, the pubic bone. Okay, and imagine the adductors are tight. She'll only come to you with the complaint of symphysis pubis in the later days of her second trimester. Okay. If nothing, you need the adductors to be flexible for our labor preparation classes. After 32 weeks, when you're working on the pelvis, you need the adductors to be pretty flexible. Okay. So that's your adductors. How you check the adductors? Make her sitting in a butterfly position and then check for the flexibility. Glutes, very important. That is, we use it for, it's a major muscle of our back, so we need it for our back strengthening. The pelvis is going to go into anterior tilting. To correct it, we need strong glutes. How do you check for the glute strength? Sorry. So glutes and thigh can be checked together. She can be sitting in a figure of 4. Okay. You can make her sit in the figure of 4. If there is tightness, the knee will remain up. Okay. But if she's flexible enough, the knee would go down properly. Okay. That's the way you can check for her glute strength. Okay. TFL, your tensor fasciae lata. All right, do your obus test, put her in sideline, and then you can check for her this. TFL is a internal rotator of the hip. Okay, so you need a good internal and external rotation of the hip when you are in your labor. Okay, apart from that, even for the general pelvic mobility, you need a good hip internal and external rotation. All right, coming to the quadratus lumborum, very obvious, it's the muscle which is parallel to our spine. So again, working on the posture. It's going to go in tightness, so let's keep it flexible. The test to do is the sideline. Tell her to bend on the side and check for the sideline, check for the restrictions which she have in the sideline position. Okay, so these group of muscles that I've noted here are very important and you have to assess them during your consultation. Okay, it's going to help you in the trimester 1, 2, and in the labor and to give you a pain-free, ache and pain-free pregnancy in your journey. Okay. Then don't forget to check her scans. Tell her to bring her latest scans, whatever she is having. And always remember to check for the anomaly scan. Like I told you, we need to know the position of the placenta. If it's very low in the second trimester, also we have to basically stop doing any exercises which are going to be which are going to be more gravity oriented. We cannot do any exercises where she's low lying, where there's a lot of hip abduction that needs to be restricted. Cervix length is very important. Note the cervix length. Any length which is less than 2.5 is no for an exercise. Okay. So if you do not know the scan, she looks good, she's come to you motivated saying that I want to do the exercise. You take her without knowing these parameters of the scan, the chances that we can, basically, we can lend her up into something worse. Okay. So if the cervix length is less than 2.5, we are not doing exercises for her. So anywhere between 2.5 to 4 is good to do our exercise. Okay. Amniotic fluid, too much of fluid, too less of amniotic fluid is again not advisable. A good 12 to 13% of water is the right one to go about with it. All right. And the last is the maturity of the placenta. If the placenta is too mature, we do not do the exercises. If it's grade 2, grade 3 in the first or second trimester itself, we do not take the mother for exercises. So note this in her scan. Okay. Now the next thing is what are the different forms of exercises that we are going to do. So call her on Monday, Wednesdays, Fridays, alternate days. Okay. So Monday, if you're doing the resistance, then Wednesday also is going to be resistance, and Friday is also going to be resistance. Alternate days. All right. So the other days that she doesn't come to you, Tuesdays, Thursdays, Saturdays, can be the cardio that she can do at home. Her walking, static cycling, swimming, whatever she likes to do. Okay. It can be a one-on-one class. Okay, you can call her to the clinic, give her 1 hour, and you can teach her. It can be a group class. When you're taking a group class, make sure it's one therapist with 4 patients. Okay, arrange them in a semicircle or arrange them in a straight line in front of you based on the space that you have. Okay, but the ratio has to be one physio with 4 patients, not more than that. 4 mothers. Okay, if you're two of y'all, then make 2 physios with 8, but make sure it's 1:4 ratio only. Okay, because you need to observe every mother when she's doing the stretches, when she's doing the form, and you need to give justice to their time that they are coming to. So don't overcrowd. Okay, and COVID has taught us how to engage mothers in telesessions. Okay, so telesession is the best thing. Mothers who are working, balancing housework, their professional work, the best thing for them is to do is a telesession. All right. So what are the different options in cardio you can give her? Walking, swimming, static cycling, maternal aerobics, okay, and maternal dance. I'm not using the word Zumba here. I'm using maternal dance because I don't want any kind of bouncy, sudden changing movements. No, not advisable. Okay. So it's going to be very light, basic movements. If the mother enjoys dancing, she can do that. Coming to the resistance training, you can use pregnancy Pilates, which I'm going to show you all today. You can add weights, TheraBands, your physio ball, and you can do it. Aquanatal exercise is the best. Taking the mother in a pool and then doing the exercises in the water. All right. Pelvic floor exercises to be specific, which are a part of the pregnancy Pilates, but you need to emphasize on that. And you can even do yoga. All right. But avoid any kind of contact sports or ball sports. Okay. Avoid bouncy movements. Okay. And avoid sudden change in direction or any exercises which has a risk of fall. It would be unfair if I don't talk to you all about the pelvic floor and the changes that it undergoes in the pregnancy. All right. So you can see in the image here, the pelvic floor stretches out. Okay. It stretches out so much that, it goes from 2 centimeters to 10 centimeters, the vaginal opening. So there's a lot of stretch to get the baby out. Okay. And with every pregnancy, the pelvic floor drops down 2 centimeters. So imagine if you're a second time mother, you can imagine the drop that has happened. Okay. So to strengthen this muscle is very important. Third thing, with the relaxin hormone in the body, the pelvis becomes very mobile. It's getting prepared for the baby to come out. Okay. But at the base of the pelvis is the pelvic floor. Okay. You have the pelvic floor muscles right down at the base of the pelvis. So imagine if these bones get mobile, the foundation down is also getting shaky. So the strength will be lesser. All right. So not then, but later once she delivers, the mother will have complaints of prolapse, urinary incontinence. She'll have issues of lot of hemorrhoids, piles. She'll come across a lot of those complaints which are pelvic floor based. So it's always good to start the training when she comes to you on day one. All right, fine. What are the do's and the don'ts? Take a green signal from the obstetrician, from the treating obstetrician. Okay. Indulge in active stretching. You don't go and do it for her. You don't go and stretch for her because, like I told you, there's a relaxant in the body. The moment you stretch, अगर वो थोड़ा ज़्यादा हुआ, there's a lot of pressure, the chances of strain which can happen. So indulge in active, comfortable stretching. Let her do it by at her pace. Okay. Use low weights and then progress. Okay. Hydrate before, during, and after the exercises. Okay. Loose and comfortable clothes, a loose t-shirt with a gym pant or a lycra pant you can wear. Make it a habit of checking her vitals the moment she comes to your clinic. Okay, she's come to your clinic. First thing first, let her sit, give her some water to drink, check her vitals. Make it a habit. Okay, it's always safe to do that. Check her BP, check her pulse oximeter, check her heartbeat. Okay, why is because there's some days where the pressure is very low. She comes to you and she starts her exercise. The chances that the pressure can drop a little more and she can have a collapse. So it's always safe to do it that way. Okay, pre and post also. So making sure that her heartbeat is back to normal before she leaves your clinic. Okay, make it a well ventilated room, not too stuffy, not too congested. Good ventilation. If not AC, then make sure the windows and the fan is on because she's going to sweat. All right, and listen to the body. Okay, what are the exercise when you have to exercise with caution? So these are the conditions where you have to give a one-on-one attention or go a little slow. Or you can say these are the high risk conditions where we need to pay a little extra attention. Okay. And when would you stop the exercise? If you have any of these symptoms like vaginal bleeding hai, abdomen pain hai, there is a sudden regular painful contraction which is happening, there's amniotic fluid leakage, sudden chest pain, sudden muscle weakness, you have to stop the exercise. Okay. Last, when are you going to say no? That particular patient, if that particular mother has any of these conditions, we are not going to involve her in any of the exercises. So it's a complete, absolute contraindication when to this type of mother. Anyone who's having a particular heart disease, who's having uncontrolled BP, who's having cervix circulage, who's having persistent bleeding, who's having placenta previa, even in the later trimesters, it's an absolute no for exercise. Okay, or if she's really having any other certain issues, like if she's having cervix circulation and she's having a back pain, you will have to go and modify the exercises so such that it is on the bed and on the sideline. Okay, not basically not exaggerating the exercises for her. Okay, so with that, I will quickly hop in for the practical session. Yes. All right. So I'll be demonstrating the exercises to you at the back. All right. I have my mat set there. Okay. So first, there are few exercises that we would be doing in standing. Okay. Like I told you, always start the class with a little of warm up. Okay. Like warm up. It's always good to start with the warm up so that you take the mother in flow with the exercise. Okay. So start with normal shoulder movements. You can do the normal hand movements. Okay. You can do the normal uh, elbow movements, active movements of all the joints. Neck and ear, tell her to move her hips. You can tell her to move her hip abduction. You can make her do her knee to chest. All active movements she can do just to pump up. Okay. You can add certain stretches as well. Okay. The one stretch that you can add, I'll teach you the stretches which are pertaining to the muscles that we saw. Okay. So one stretch that you can add and is required for the upper body is the corner stretch. Okay. So what do is you go in the corner of the room. All right. Keep one hand on the adjacent wall, one on the other. Keep both the legs together. I don't want you all to lunge. Okay. And then you're going to tell her to put her chest in the corner. Okay. This is going to stretch her pectoralis and open her chest for any kind of rounded posture. All right. She has to exhale, no holding her breath. You're going to exhale while you're doing the exercises. No holding the breath anywhere. Whenever there's any form of stretch which is coming, you have to start exhaling. Okay, right? So this is going to open up our stretching our pectorals, opening up our chest. Okay, this exercise you can do in the upper body. Now, working on the TFL and the quadratus lumborum, what you can do is tell her to be on the next to a wall. All right, the leg which is supporting near the wall is going to be on the side, and the other leg, which is the outside leg, is going to cross. I'll just pan the camera a little down so that you can see my lower body. Okay, so there, okay, and the other leg is going to be crossed. Okay, give a wall support because you need the wall it just to make sure that make sure that the her posture is not her proper or she's not losing her balance. Either a chair or a wall is better. So keep your elbow like that, the right leg in front and the left leg ahead. The side which is there is going to be there and the other is going to be crossed out. Take your hand up, inhale, exhale, and reach out to the wall. Okay, you work on a TFL, you work on a quadratus lumborum, and you are stretching out the muscles there. Exhale, hold there, and once you're done exhaling, come back. Okay, similar on the other side, we keep our legs there, legs cross, the side which is near the wall is there, and the other is in front. Inhale, hand up, exhale, reach to the wall. All right, and then you're going to come up. We stretch the TFL, we stretch the quadratus lumborum here. Okay. Now, breathing, when I say I want to tell you all here, make sure you can hear her exhale. She'll say, yeah, I'm exhaling. No. Tell her I want to hear that flow out. So sniff a flower, that's how I tell my patients, sniff a flower and blow out a candle. Okay, so that should be the type of breathing she should be doing when she is exhaling. All right, inhale and exhale. Okay, now the next stretch that we are going to do is for the spine. Okay, the entire spine, which is very good, which is very comfortable and relaxing for the mothers. Okay, I'll do it here. Fine. Tell her to stand against the wall. Okay, with little hips a little apart. All right, shoulder, elbow, wrist in one line. Okay, and then tell her to take a deep breath in. She inhales. Exhale and take your hand, head at the back, hip at the back, head between the hands and exhale and be there. Okay, this stretches our hamstrings, stretches our lower back, stretches our upper back. A whole spinal stretch. This is very good. All right, I'll show it to you all again. I'm standing there. I'm not standing parallel to the wall. I'm slightly inclined to the wall. Okay, I take a deep breath in. While I exhale, I take my head in between the hands. All right, and I slowly come up. Okay, just to add a progression here and to work on the quadratus lumborum more, I do the same thing. Inhale, exhale out, and I rotate. I give a rotation. Okay, so this is going to work on my quadratus lumborum, my lower back, and my hamstring. Okay, and I come back. Same thing on the opposite side. Inhale, exhale, and down, and twisting on the opposite side. Okay, there is good thoracic mobility which is happening. There is good amount of quadratus lumborum stretching, and the whole spine gets that stretch there and that. All right, no bouncy movement, no bouncy movement, no jerky movements. Active, slow, rhythmic stretches. Okay, now let's see the stretches to the lower body. We'll see the iliopsoas first. Okay, now take a chair. Okay, let's stand the camera a little down.
Please adjust the camera accordingly
Yes.
so the legs as
Yeah.
well.
Right. Okay. I'm showing you the iliopsoas stretch. Okay, mothers who have iliopsoas tightness, keep a chair. Make sure it's against the wall. All right, not like that. currently because of the position I'm showing you without the wall, but make sure it's against the wall or something which is sturdy. All right. The leg has to be up. One leg is going to be up. The other leg is going to be down. All right. And inhale, exhale, and lunge down. It's going to stretch my whole ilio. Okay. Just to add that little extra progression, take the hand up on the same side and bend on the opposite side. Okay, I think this progression I have to turn the camera a little up. All right. So you lunge first. To add the progression, take the hand up and side. Come back center and down. Okay, I'll show it to you on the other side. My other leg is up. I first lunge. Okay, just to add that progression, I'm going to take my hand at the same side, hand up, and I'm going to side. This is stretching my ilio, it's stretching my core, it's stretching my back leg, the leg which is down, it's stretching my hamstrings, my calf, my thighs on that side, along with my ilio. Okay, and I come back. All right. Similarly for the adductors, you can do a side lunge. Okay, you're there, facing the mother has to face you, leg up again. Make sure the hip and the knees in one line. She's going to inhale, exhale, and down. All right, once again, inhale, exhale, down and hold. Okay, so here the pelvic floor is stretching, the adductors are stretching, and even the other side adductors also get stretched. Okay, and we come back. All right, this can, even if you feel the mother is comfortable and she is good enough to go down, like on the mat, you can give this lunges in half kneeling as well. Like you're there and you take down. Okay, or for the adductors, half kneeling and there. Okay, a good stretch to the pelvic floor, good stretch to the adductors, and there. Okay, so either modify it in half kneeling or you can do it in the chair. In case she is having any knee issues or she's a little obese or she's not comfortable to go down, you can do it with a chair or something which is sturdy. All right. Now this stretches can be added as a part of your warm up as well. Okay. Now let's go to the strengthening. Okay. So I will be on the mat so that I don't have to keep changing the position of the camera. Yes. Okay. All right. So when I'm in my second trimester, it is advised not to be in the supine position for too long, right? It's not a good plan to be in supine position for too long. I'll take the camera down. Yes. Okay. It's advised to all the mothers not to be in supine position for too long. All right. So if you have to do exercises, you can either take her in crocline, supine position, be there for some time. After every set, make her change the position. Or if you want to avoid that, you can just take a pillow. Okay. You can keep a bolster as well, where you know, her upper body is a little higher than the lower body. Okay, her upper body should be a little elevated up and then the lower body. You can use this position if you're giving any exercises in supine position in the second trimester. Okay, not complete down, keep her upper body a little bit elevated. You can use a bolster, you can use a thick wedge like that. I use this wedge, so that's why I have used it. It's a broad, comfortable wedge which I can use. Okay, this will help you avoid the supine hypotension syndrome that you get in the mothers in the later days of the second trimester. All right. Now here I'm going to show you all the hamstring stretch. Okay. All right. The hamstring stretch is similar, but make sure that the other knee is kept bent. Okay. The other leg is straight. You can put the band, or tell her to put the band across the foot and slowly elevate her leg up. Okay. Ankle, knee, hip should be in one line, and she elevates and stretches the hamstring. Okay. And she slowly comes down. Perfect. And we do it again. Up there, exhale, and you're going to come down. Okay. So that's the exercises you can incorporate with your hamstring stretches. Similar on the other side, the opposite knee is going to remain bent. You're going to put the band across the forefoot. Okay. Inhale, exhale with the band up. All right. Coming down again. Inhale, exhale, and we go up slowly. Okay. So these are the stretchings for the hamstring. Coming to the pyri, I forgot to show all the piriformis and the glute. Again, in the same position, coming to figure of four. Okay. What we usually do, we take both the knee to the chest, right? But here you're just going to take one ankle to the chest. Okay. You'll take just one ankle to your chest, exhale and be there. It doesn't press your bump because the thigh is coming a little outward, and you're going to inhale, exhale, and same thing on the other side. You take a deep breath in, inhale, inhale, exhale, and ankle to your chest. Okay, that's how you stretch your pyri and your glute. So all the stretches can be incorporated as a form of your warm up. Okay, now coming to the main exercises, the strengthening exercises. Okay, like I told you, the first exercise that I'll be teaching and talking about is the core breathing. Okay, core breathing can be done in sitting. She can be in sitting position. She can be in a recline position. She can be down in the recline position. She can be sitting. She can be even sitting on the chair. Okay. What I want you all to do is either take a scarf or a theraband. Okay. You're going to wrap it up to her upper part, basically the lower ribs. Okay. Just below the chest. All right. You're going to tie it up there, not too tight, but snugly fitting enough so that you can feel her ribcage moves. Okay. What are we going to do here is this core breathing that we're going to do is going to engage all the core muscles. Okay. And this is going to be the basic or the start to any other exercises that we're going to follow. Okay. So what we do here is first we tie the band. All right. She's sitting with the back support. Okay. She has to inhale, all right, from her nose till the lungs expand well. There can be a little expansion in the tummy as well. She has to relax her pelvic floor. Okay. Relax her pelvic floor as in make sure all the three openings down there are open. Okay. And when she's exhaling, she has to first squeeze the pelvic floor. My hand is my pelvic floor, right? She has to squeeze the pelvic floor. Okay. Take the belly a bit in, like tuck the belly in and get the air out through her mouth. Okay. So when you're saying squeeze the pelvic floor, most of the time mothers squeeze the butt muscle. Okay. So just give her a simple instruction saying that with your vagina, try to lift a coin up. So she'll try to focus on the vaginal muscles more. Okay. Don't say stop your motions or stop your urine muscles. Urine muscles are very fine, and the rectum is a big portion which usually engages the glute. Okay. And we don't exclusively engage the pelvic floor. So the best thing to give them, cue to give them is lift a coin with your vaginal muscles. So that's how she'll do that spine open and close down there. Okay, so I'll show you how to do the exercise. She's going to sit, all right, the band is tight. She's going to take a deep breath in through her nose. Lungs expanded, tummy slightly expanded, pelvic floor is relaxed. All the three openings down on the pelvic floor is open. And when I exhale, I'm going to lift the coin up with my vagina. Take the belly in and lungs down. Okay, I'll show it to you all in the side view so that you can appreciate that. Okay, I'll keep my hands in front. I inhale, I'll keep one hand on the tummy so you can appreciate that. Okay, my pelvic floor is relaxed. While I'm exhaling, first I engage my pelvic floor. Take my belly in, lungs go in, and air out through the mouth. Okay, so this is the basic to your core breathing. The first trimester core breath that I was talking about is to activate all this core muscle. Give it to her in crook line, give it to her in side line. Do this exercise on all four. Do this exercise in sitting. Do this exercise in standing. She will find it difficult. It's not easy. It looks easy, but it is not easy. All right. So when you change the position, it gets even more difficult. Okay. So this breathing is going to be the basic before we start any of the exercise. Okay. So now I'm going to show you the strengthening of the butt muscles. Okay. So you can take the wedge or you can take a pillow as well under your head because they're going to be in the supine position. Okay. My knees are bent. You can keep the band or you can get it out, however comfortable you are. Okay. The first exercise that we're going to do is the breathing. Okay. So we inhale in first, do the same core breathing, relax the pelvic floor. While I exhale, first I'll engage the pelvic floor, take the belly a bit in, and slowly lift my hip up. Okay. Be there till I count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And slowly descend down and relax the pelvic floor. All right. Always remember to do the breathing. It's not this and that. It's just not functioning or just not working where it has to work. Okay. So you inhale first, relax the pelvic floor. While you exhale, you squeeze in the uterine muscles. Count 10 for her while she continues the exhalation. And you'll go down and you'll relax. Okay, this is the breathe. The first and the foremost and the basic exercise that you're going to do is for the butt muscles, your bridging. Okay, you can add resistance to the breathing in the second trimester by putting a band around the knees. Okay, keep a band around the knees. You bridge up. Okay, and like same, you do the same drill from the start. You bridge up, and then you can add open and close. Back, 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 and then slowly coming down and relaxing again. So you can progress, you can add, resistance in the same glute form with different equipment. Okay. Similarly, if you want to do another form of bridge, like suppose you want to do a frog bridge, what do you do? What do you do in the frog bridge? All right. So what do we do in the frog bridge? We first open the knees out. All right. We take a deep breath in, relax the pelvic floor. Exhale, squeeze in the pelvic floor, and then slowly lift your back up. Be there. Count 10 for her. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then you slowly come down. And then you relax. And then get the knees in. The band on my knee is giving that extra resistance to my hip muscles. Okay. But if you feel no, she's not ready as of now to use the band or the weight, give it without any kind of additional resistance. Give it only with give it only with her body. Okay. Don't give it to her with any resistance. All right. So this is regarding the bridging. You can do your single leg bridges also without the band, of course. You're going to do the single leg bridges. Same pattern, inhale, relax, exhale, squeeze, and then she goes up. All right. Plain bridge, bridge with the band, frog bridge, single leg bridging. These are the various progressions you can add to your bridges. Okay. Now let's go to the side line. In sideline, you can make her be in the sideline position, okay? Or the best thing to do is keep her propped up. So when you're in this position, what is happening? Your obliques are also working. So you're targeting एक पत्थर से एक पत्थर से दो birds, what we say, it's something similar, okay? So in one exercise, you'll work on the obliques, you'll work on the glutes as well as the pelvic floor. In case she's having upper body weakness, I'm okay if she's on the pillow. All right. So she's turned to one side, hip, ear, shoulder, hip, ankle in one line. Okay. You can do it with the band or without the band based on her resistance. Inhale, relax. Exhale, squeeze in, engage the glute. And then she can open and hold. Okay. With that, will you count 10, come down, and then you relax. Okay. I'll show it to you once again. We are there. Make sure the spine is not down there. Okay. It's up. Okay. Maintain that slant line. All right. Shoulder and elbow in one line. We're going to inhale, exhale without breaking that line. Okay. It's not this. I don't want you all to turn. So without breaking that line, you're going to be there. There would be a good pressure on your butt muscles. With that, you count 10 and then slowly come down. Okay. If you want to work on the adductors in the same position, you can keep the Pilate ball. Okay. Put the Pilate ball in. Okay. My obliques are working, my pelvic floor is working along with my adductors. So I'll inhale. While I exhale, I'll squeeze in the pelvic floor and I'll give a good pressure to the ball. Okay. Progress it a little more. If you feel this confident, bring her to a sideline position. Okay. Again, elbow in one line, hip is up, ankle is closer. Inhale, exhale, inhale, or sideline with the clamshell, what we did. Like opening the hip against the band, being that you count 10, and then come down and relax. Okay. So either on the sideline or propped up position and the progressions for the clamshell. Okay. So you choose which muscles you want to work, which muscles you are looking forward to strengthen today, and that is how you will do it. Okay. Now I'll show you something in all four. Now, when you come to all four, it's basically making a square between your limbs and your hands. I don't want the hands too out. I don't want the hands too much in. Similarly for the legs, not too out, not too in. Okay. You're going to make a nice square. When you look down, there should be a nice square that is happening to your body. Okay. I'll show to you on sideline. All right. Okay. So I am there. Okay, a nice square is made. You can start the breathing here. You can teach the breathing in this position. Once you feel she's good with the breathing, she can tuck her toes and do the bear Pilates, the bear hold. Okay, so she's going to inhale, relax the pelvic floor. While she's exhaling, she's going to tuck in, engage the pelvic floor muscles, engage the core, and lift the knees off. Okay, the knees should not go higher than the back. They should be in line with the back. My knees are off the mat. I'm going to be there till I count 10. And then slowly down. Okay, I'll show it to you in the front view. From there. Okay, inhale, relax. Exhale, engage the pelvic floor and the core, and up. And down. Progression, keep the ball in between. Okay, inhale, relax. Exhale, engage, squeeze the ball. Down, relax. Once again, inhale. Exhale, up. Squeeze the ball. Even more progression, band around the knees. Okay, put the band around the knees. You're there, up, open, close, open, close, open, close, and then down. Okay, so design your variations based on your patient's intensity. Okay, Other ways to do it is, other ways to work on the glute exclusively is there, taking the leg up, back kicks. Okay. Again, coordinating it with the breath. Okay. Just the knee lifts, the donkey kicks. Okay. Make sure you're not rocking, or when you're doing the back kicks or the knee, it shouldn't be swaying out. This is wrong. Okay. Your hip and knees should be maintained in that one line. Inhale, exhale, engage, and this is what is required. Not shifts. No shifting. This is wrong. Okay. You're going to be there and there. This hip and knee should be in that one line. Similarly, on the side, and we do it. All right. And with the back kicks also, it's that. No shifting. It's going to be there and like that. Okay. Down there, just there. Like that. All right. Again, progression, put weights on the ankle, put bands around the knees. Okay. You can keep this as a progression. All right. So these are some of the exercises that I wanted to show you in the strengthening part. Okay, let me take one condition. We have time, right? Dr. Swanika, we have time. No, we are over time. Can I take one condition of round ligament?
Yes.
That's very common.
Yes.
Okay, fine. So I'm sure many of you all must have encountered mothers who come and say, I have a pull, a stretch kind of pain, which is in the lower groin here, which goes up here, especially in the second trimester. Okay, that's make sure. Of course, you have to evaluate it well. I told all the muscles to check for the tightness, check for those tight muscles. Okay, but if it's a round ligament pain, now what is round ligament is? Suppose this is my uterus. Okay, all right. The uterus is usually inside the pelvic cavity. Okay. But in pregnancy, it's come out. All right. It's expanded. Can you imagine the ligaments which are next attached here, like the ligaments which are tied? Suppose this is the one ligament. This ligament is also getting stretched from the base up there. All right. The uterus is coming up till your GC sternum by the ninth month. And the same time, the round ligament also is stretching. The round ligament also gets that long stretch. Okay. And this will give you a pull. All right. So round ligament pain is usually unilateral. It will be one side. Okay. It will be a stretch kind of pull, which will be there for some time and then it goes off. Okay. It's not like a labor contraction will come, be there for some minutes and gone. No. You'll get that pull once or twice a day, or a sudden catch will come once or twice, and then you're fine. Okay. Or sometimes it is very irregular. Okay. It's not regular like your labor contractions. So it's very irregular and it's a positional change, mostly with position. When you're shifting from sideline to supine, or when you're shifting from supine to sitting, when there is some position which is happening, that time you get that sudden shock kind of a pull. Okay, there's no association of this with the cervix. There's no changes happening in the cervix with the round ligament. Okay, so that's how you differentiate. Basically, they are irregular. They usually come with positional changes, and they are unilateral. They're usually on one side. Okay, so this is your round ligament pain, very commonly seen. So how do we treat the round ligament pain? Is take a chair. All right, tell her to be in this position. Okay, I can tell to be in this position, leaned forward on the chair, and in this position, tell her to do the cat and the camel. Inhale and arch her back, drop her pelvis down. Exhale and squeeze the tailbone in. Inhale and out. Exhale and squeeze it in. Coordinate with her breath and the pelvic floor relaxation. Relax the pelvic floor. Inhale. Exhale and squeeze in your butt muscles and in. Okay. Why incline and why not a normal cat camel is? Because when you're in this position inclined, the alignment of that ligament gets better. Okay. The alignment of the ligament gets really well when you're rather than when you're on complete also. Okay, so this is the one condition which is very common, round ligament pain. There's low back pain. You can do a really good glute exercise, whatever I showed you all. You can do that. That will help you to strengthen the back pain. Symphysis pubis pain, very common. Work on the pelvis tilt. Okay, The pelvis has gone into too much of anterior tilting. That's why you have the symphysis pubis pain. Work on the adductors, work on the glute muscles, work on the pelvic floor. Try to keep the pelvis as much as you can to the neutral. It will tilt. Every pregnancy tilts the pelvic floor. It tilts the pelvis anteriorly. But if with exercises, it will be slightly tilted. Okay, and you will prevent all the discomforts which are happening. Okay, good. And I wanted to show you all the abdominal separation, how to assess when we're doing the consultation. She is sitting, okay? Tell her to lean back slowly, okay? And when she leans back, you'll see like a coning which happens here, you'll see like a cone. It's actually near the belly, especially belly umbilicus, you see that coning which is happening. Okay, so that means there is separation of the abdomen. All right, fine. And then you can do the cool down. Cool down can be done with any of the stretches that I showed you all. You can do it just by lying down and breathing, normal Shavasana. Okay. Or you can do again with any movements. Okay. Keep the whole exercise program stretched to 30 to 35 minutes. Okay. Design what all you want to address for her when she comes today, or the mother when she comes today. Okay. Make sure you're giving her water breaks in between. Okay, after every 10-15 minutes, give her time to come up and sip some water. Let her put some peanuts or some dry fruits or munch on some fruits in between. I'm absolutely okay even with that. Okay. 45 minutes before coming for the class, she has to have her meals. Okay, basically be on an empty stomach when she is 45 minutes before the class. Okay, I hope I've covered most of it. All right. All right. So with that, we will end the practical class, the practical section. We can take the question answers, and we'll see if there are any exercises, recommendation in the question answer section. We can take that. All right. Should I be taking the question answers or somebody will read out to me, Dr. Swamitha?
Dr. Rashmi will be doing it. She is just taking all the questions from everywhere. Dr. Rashmi, please take over.
So honestly, there is no specific one book, okay, which will have all these exercises together. All right. Like in the last so many years, at least I have not encountered a specific book which says trimester one, give this exercise. No, you just need to understand the principles, just need to understand the consultation, and based on that, decide your program. Okay. And I think the next session is going to be on all the exercises that you're planning to do in the third trimester. Okay. The labor preparation case. So the goal, the specificity, the goal there is entirely different than what we have in the first two trimesters. All right. So I've tried to cover maximum. Let's address the question so that if there's anything, we can answer it.
I will start in the question and answer in the meanwhile, because
Sure.
Rashmi has, I think, logged out. So
Okay.
while that is happening, we'll start with the first question.
Sure.
It was like the first question we had is, can you repeat flexibility test for glutes and PFL in the practical session? I think you've done that.
Yeah. You want me to show it again?
Uh,
Quickly?
I
Okay.
think quickly
So
you can show that, yeah.
yeah. When she's coming in for consultation and you want to check it, one is she's sitting with a no support. Okay, make her sit on the chair without the back support. Tell her to make a figure of four. Okay, the changes that you'll see the moment she goes in this is either she'll be leaned on one side. Okay, thigh is coming up. All right, she'll be there like that. Okay, so the moment you know she's in this position, you know it's tighter. Okay, so this is the tight glute, tight pyri, which is going to give this, or the difficulty to come up in this external rotation. Okay, so that is what is going to be the first indication. And stretching is normal, how we go crook line, figure of four, but don't take both the knees to the chest, just take the ankle to the chest and then you will stretch it in crook line. Okay.
Yes. So the next question is, can one keep exercising before a person before she gets pregnant? Can she
Yes, of
continue her
course.
exercise?
Yes. So if there's somebody who's an athlete, for example, okay, there's an athlete who's coming, who's pregnant, all right. I can't tell the athlete, no, stop your exercises. You have to stop for your sports, whatever you're doing. No. Of course, I'm going to give her a heads up that you can't do any kind of, if she's into any contact sports or she's into any kind of high intensity exercise, I have to tell her to drop that intensity down. Okay. Continue her sports. At the same time, make sure that she's taking care of the intensity and her fatigue level. Okay. So she can continue the same line of exercises what she's been doing. If she's an active lifestyle pre-pregnancy, she can continue with that. But yes, in the first trimester, avoid any hip abductions, squattings, okay, and be a little low on the intensity based on her capacity. But yes, she can absolutely continue with the same exercise that she's been doing before.
Great, thank you. And when will be the best time to start seeing a physio once a woman gets pregnant?
Safer, like I told you, 12 weeks after the first trimester gets over, to be very honest and very safe, because you have your anomaly scan. 12 to 13 weeks the gynacs will advise you. You know the position of your placenta, you know the cervix length, you know the amniotic fluid, you know the baby is developing. Okay, so after the first scan is the right time to, after the first anomaly scan is the right time to engage. But if you're motivated and you want to do it before, you can start it the day you know you're pregnant as well. Okay, but yeah, individualized program is important. Each, whatever you see on YouTube, whatever you see on Google, not everything is good for you, right? So meet a professional, understand your needs, understand the needs for your body, and get an individualized, structured, tailored program for you. So anytime after 12 or even the first trimester.
Thank you. So
Yeah.
once, if a woman is pregnant for the second time, are there any
Yeah.
precautions that she should take or exercise she should or should not do?
Uh, uh, should not do exercises. I would say if there are any comorbidities, which we have just discussed, if you have like placenta previa or cervix circulation or uncontrolled hypertension, seizures, if you have any of that, then should not do exercises at all. Okay, but which she can do are, like, when she comes to you the first time, evaluate her, check for the abdominal separation, ask her about the pelvic flow, how it was after the first pregnancy, and then you can continue. So there are no exercises which are like absolute no until and apart if she has a comorbidity, but otherwise she can continue with all the exercises, whatever we have discussed, and taking into consideration the consultation.
Okay, so the next
Yeah.
question should be, should you have your pelvic floor checked even if you aren't experiencing symptoms or if you're planning a C-section?
Okay. So when you're pregnant, the day you know you're pregnancy positive, no pelvic floor therapist will do an invasive session for you to check your strength. No. It's an absolute no. Nobody's allowed to insert the finger in. Never do it when she's pregnant. One is because of the hygiene, you want to maintain the cervix, the mucus plug which has happened there safe. You don't want to disturb that. So no pelvic floor therapist will do an invasive session for you in pregnancy. The symptom, you're going to get the symptoms or understand the pelvic floor based on her clinical discussion, the clinical history that you'll be taking. So you'll understand it from there. Ask her questions on urine dribble pre-pregnancy. Ask her questions on when she was sneezing or coughing, there was a dribble. Okay, so you can ask her history. In the history, you can gather the information about the pelvic floor strength. Okay, you can ask her about the if she of any history of prolapse by asking if there was any bulge kind of sensation in the vagina when she was pregnant. So you can you can get the information from the this by the clinical history and not by the examination. Like, never insert your finger in the vagina and check her strength. Okay, so only based on the clinical history you can start addressing the pelvic floor. And like I told you all, make it a part to engage the pelvic floor any exercises you all do, like by inhale and relax, exhale and squeeze in. So with that, you're automatically activating your pelvic floor. So you don't have to do a separate session exclusively for pelvic floor. Let it be a part of your pregnancy pilates that you're doing.
Can you explain about diastasis recti exercises?
Yeah, sure. So that basically diastole recti exercises basically come as a part of your fourth trimester. So that's basically your postpartum. But since it's a query asked here, I would like to address it. First, you assess the separation. How much is the separation? And the best time to check the separation is 6 to 8. Sorry, it's 8 weeks of your delivery. Like, you should finish your purparium phase, and 8 weeks after the delivery, you can check for the diastasis, okay, by putting the finger at the belly button and then you just lift your head up, okay, in the crook line position and check for the gapping. All right. If it is two fingers at all the three levels, above the belly, at the belly and below, it's gender, it's normal, it's healthy. But anything more than three, if you have like a three-finger gap, okay, you see a proper coning. When she comes up to see her knee, you see a proper coning happening. You see that looseness which is there, and the gap is of three fingers. You know that it's a proper diastasis, right? It's a proper weakness of the muscles which has happened. Okay. In such cases, start with core activation first. Don't directly load her with exercises with like tabletop or doing legs out. Okay. Or simple, I'll tell you, just remember whatever exercises you're giving her, and if you see there is coning, that exercise, she's not ready for that exercise so far. Okay. So just watch for that coning. Okay. If there's coning happening in any of the exercises, she is not yet ready for that exercise. Okay, so the best way to start is just to activate the muscles by your core breath. The core breath that I told you, tell her to squeeze the core, relax, squeeze the core, relax. That itself is going to set in the tone in her. Okay, start progress on the mat exercises. Do bridges, do your bridging exercises. They work on the glute, but simultaneously, when you're doing it with the breath work, they even engage the abdominal muscles. Okay, do not go to do, if there's more than three fingers of gap, do not go to give any oblique exercises. Okay, wait for some time. You can take her in sideline, don't prop her up. Take her in sideline, but don't give any oblique exercises. So that's going to cone more. So instead of doing anything good, you're just worsening it for her. All right. So if it's more than three, avoid more than three fingers. Avoid any oblique exercises till the gapping reduces. Once it reduces, then you can add. And if there's any coning happening in any exercise, that exercise is not meant for her. Okay. So come down, progress slowly.
Okay, thank you. Dr. Anika
Yeah.
wants to know if you can suggest any book that gives more details about variation in cases and to deal with complications.
Right. Like I told you, there is, at least I have not come across any of, like, while I was doing my masters and then now in the phase of practice, there's no specific book which will tell you all about, okay, this trimester, this exercise. No. As a physiotherapist, understand the biomechanics, okay? Understand the postural changes which are happening, pelvis tilts, whatever changes happen to the alignment upper, what happens down, and then address those muscles. This is what I even teach my students, okay? Like, the glutes are going to get weak because the pelvis is going anterior and start strengthening the glutes. The abdominals are going to separate, so start activating the abdominals. The upper back is going to go round, so start working on the upper back muscles, start stretching the front of that. Leg goes in forward, so working on that. So as a physiotherapist, work on the biomechanics and the posture, and she should be good. So not like I know of any one book which will talk about, all the terms. You'll have to read some articles or understand, read the biomechanics first, and then work on the muscles, whatever are getting involved with that.
Great. Yes. Thank you. The next
Yeah.
question is if somebody is planning a pregnancy,
Yeah.
what exercises can they start with?
Perfect. I mean, this is some question. Whoever has answered it is amazing. Okay, it's always good to be prepared for something. So even if you're planning a pregnancy, okay, when I work, I have something called as preconception evaluation or preconception classes that I keep for 1 or 2 days. Okay, so this is always best. When you're prepared for something, you do that activity really well. It's like going for an exam. Okay, when you know what you have studied, you're able to answer that exam well. All right. So if you know what you have to do in your pregnancy and you pre-plan it, it's the best thing to do. Okay. So first is go meet a therapist, meet a physiotherapist, and understand your body. Okay. Check your posture, get your posture evaluated. If there are any particular muscles which are tight, if there which are too tight, or if there's any particular postural deformity that she already has. One is very common is the hip hike. Like if you check the iliac crest, very common in girls because of the sitting posture that we have, sitting on one leg, sitting on cross leg. Okay, majority of the girls will have like that one iliac crest up, so that little of upthrust is going to be there. There'll be a kyphotic posture. The pelvis is going to be anterior. Already weak core, abdominal muscles. Pelvic floor is sometimes weak. Okay, they don't realize it till they get pregnant, but pelvic floor can be weak even pre-pregnancy. All right. So meet a therapist, meet a physiotherapist, understand your body better, work on those muscles. and then you can go in for the then go in for your pregnancy. So whatever deformities you have, like postural deformities is maybe a hard term, but whatever postural changes you have, work on those postural changes, get your corrections done, and then conceive. Secondly, a diet form of view, if you ask me, then I would say a good source of folic acid, good source of protein, and good source of iron, along with vitamin D. Try to incorporate these things in your diet and the exercises to get your posture correct, and then you can go in for your pregnancy. If you have a comorbidity, if you're already a BP person, okay, work on your diet. So when you work on these things as in form of diet and your exercises, adding a little of cardio, maybe swimming or maybe walking, it's going to work on your cardio as well. So you can sustain those 9 months very comfortably and properly. If you are like a little on the obese side, a little on the weight, you have a little more weight gain, work on your weight, get your BMI under control, and then you can go in for your conception. Okay.
Yes, thank you. So the next question is when a woman is experiencing urinary incontinence, is Kegel exercises enough or during pre and post pregnancy, or she should do something else too?
Okay. Now, when we say pelvic floor, the only exercise which pops up is Kegels. But let me tell you, it's a world far beyond Kegels. Okay. Kegel was one person who started this exercise of it's simple, it's squeeze out, squeeze out. All right. So Kegel is a part of your pelvic floor program, but it's not the entire program. So sometimes not every mother might require a Kegel. All right. Not everyone's pelvic floor is meant for a Kegel. It might there might be something else that the pelvic floor demands for. Okay. So first is like I told you, when you meet a therapist, pre-pregnancy is the best thing. If you're having a pelvic floor weakness, before you conceive, you meet the therapist, understand the strength, start working on the pelvic floor. Okay. But if you're pregnant and then you start noticing symptoms of urinary incontinence or, urge incontinence, whatever is there, you can engage and do the pelvic floor exercises like I told you. But there is nothing anything which is going to be invasive. There's not going to be an invasive session for you. It's going to be everything external, incorporating the associated muscles. The associated muscles to the pelvic floor are the adductors, the glutes, and the lower abdominals. They work in synergy with the to the pelvic floor. So if you want to engage, like how I told you, putting the ball in between and pressing, so that I'm going to engage the pelvic floor with my breath, plus I'm pressing with my adductor. So it reinforces my pelvic floor. Okay, you basically use principles of PNF here, reinforcing. So you reinforce the adductors to strengthen your pelvic floor muscle. You reinforce the glute to strengthen your pelvic floor. Okay, so you do exercises which are going to be like a reinforcement to the associated muscles. Okay.
Okay.
I hope
Thank
I've
you.
answered that.
Yes, thank you so much. How will we know if she is squeezing the pelvic floor or not? How will the physio know?
Yes, that's a fantastic question. So the core breath when we do, okay, keep when she's in the core line position, keep one hand of yours on the glute. Okay, keep it on the glute cleft. So she's lying down. All right, keep your one finger on the glute cleft. Okay, and make sure she's not squeezing the glute, because a very common muscle to get squeezed, thinking it is pelvic floor is the glute. Okay, so give her that feedback. Okay, now you're squeezing your pelvic floor, you're squeezing your glute muscle, and I don't want that to get squeezed. Okay, so the best cue to give her is lift the mulberry or lift the coin with your vaginal muscle. And it's a very gentle tap. I don't want that 100% squeeze in the pelvic floor. That is not what it should be also. Okay, it's just that shutting of that vaginal muscle. Imagine as if you're lifting the coin up. So lift that coin up with your vagina and up there. Or just move up like a lift. Okay, or just close the rectum and the vaginal muscles and the urinary muscles, just shut them. So it's not that 100% squeeze that we do where we engage our butt muscles. No, it's just that 20-30% of lift that you feel, which is only for the pelvic. Okay, but the best thing to do is first show her the pelvic floor, like just show her the 3 outlets and tell her these are the only outlets I want you to squeeze on. Okay, the rectum, the vagina, and the urinary muscles. Okay, so one is you can do is keep your hands on the butt muscle when she's in the crook line position. Just keep one hand on the butt muscle and make sure she's not clenching her butt. Yeah.
Right. Thank you. So the next question is, if a patient says that she is doing yoga or prenatal yoga, how does one convince her for prenatal exercises? And how does one differentiate between yoga and prenatal exercises?
Right. So, see, there are two different concepts. No getting any insecurity that, okay, she's doing yoga, how will she come for my classes? No. I have mothers who do their yoga and the other days that they don't come to me. And the days that they come to me, they do my pregnancy Pilates or whatever exercises I have designed for them. Okay. So, they do, both of the things are very different. Okay. Yoga works on the flexibility, yoga works more on the, maybe the breathing content and all that. We work more on the posture. Okay, the anterior tilting, whatever is there, what the pain that is there, the back pain that she's facing, the symphysis pubis pain that she's having, the diastasis, the tailbone pain that she's having, or the spinal changes that she's having, that a yoga therapist would not, or a yoga exercise would not be able to fix. Okay, that for that she'll come to you only. Okay, so moreover, in my clinic, I have a yoga therapist who comes and who takes yoga exercises for my mother because that basically makes my focus on the flexibility part handled out. Okay, but when it comes to the strengthening program, when it comes to the alignment, when it comes to the balance, it will come to you. It is your case. You are going to handle it because you are the person who deals with posture. You are the person who knows the body well. Okay, so if you want to convince, you can tell them that these are the flexibility exercises, but your aches, pains, discomfort that you have, and the labor preparation classes, whatever, like, what happens during labor, the pelvic floor opens up, what are the movements that your pelvis needs to do. Okay, not in all the 10, the 6 or the 7 hours that you're in labor, the 12 hours that you're in labor, you can't be in lying down position. So whatever positional changes, what position to do when, what exercises to do with when you have a pelvic floor dysfunction, these all will be addressed by a therapist only, a physiotherapist only. So tell them that there yoga is only going to work on your flexibility, but the strength, the muscle endurance, and the muscle strength is going to be developed by the exercises that we are going to do with the physio.
Thank you. The next question is there any chance of improvement in diastasis recti after 2 years of delivery?
Of course, there is. I mean, even after 5, to be very honest, like we have come across mothers who want to do second pregnancy after 5 or 4 years. They come and we see there's a diastasis. There are good results which you can see, but like I told you, all, address the problem properly. You see that big belly of that, that big pouch which is remaining, and you feel, oh, this is not going to work. No, if you address it properly, with the proper basics, with the proper alignment, with the proper postural alignment, with the proper breathing technique, like I told you breathe every second. So if you teach her the breathing technique properly, like how to engage the abdominals, how to engage the pelvic floor when she's doing, you can definitely work on the diastasis rectus even later. Like, and not by only women, even men. Like even men who's having diastasis rectus, we can work on them whenever they come to you. So yes, you can address it, but with proper knowledge of your basics, your alignment, your spine, your posture, everything.
Thank you. The next question, if there is an inguinal hernia during pregnancy, what are the exercises, pros and
Yeah.
cons should we teach them?
Should avoid. Very good
Yeah.
question. So whenever there's an inguinal hernia which is there, which is like an associated, I mean, it's like a condition where we have to see a one-on-one. I would not advise such mothers to come in a group class. Avoid exercises which are going to be a lot of weight bearing down. Okay, like suppose you want to do exercises in deep squats for her. You want to do some exercises which are going to be like lifting some additional heavy weights. Like for example, you're giving her a barbell. You want her to lift a barbell and train her in that. I wouldn't suggest those exercises for such mothers. Try to be in supine. Try to take her in all four. Try to work in the sideline. Even in vertical, she can, but avoid loading in vertical. Holding the dumbbell, squatting down is something I wouldn't advise. Okay, so no vertical loading, no bearing down too much, like no sumo squats and then doing exercises. I wouldn't advise of those because it's only going to give more pressure and get that little intestine part which is popping out will pop out more. And secondly, whenever she's doing these exercises, uh, we are going to work on the abdominal strengthening as well. That's going to be a part of the program. Of course, she won't see a big difference with the bulge. I mean, there won't be a massive difference with the bulge, but with the abdominal exercises, there would be a little reduction in the size. If it's a reducible inguinal hernia, you will see a little reduction in the size also. Okay, so make sure she's not doing any Valsalva, not lifting anything excessively heavy, okay, and not doing exercises which are too much into weight bearing. Okay, and pros are we are strengthening her abdominals, we're strengthening her pelvic floor, so it's only going to make it a little better. Not 100% working out, but it's only going to strengthen that core muscles better. Like basically, not pop it out more.
Thank you. So this is a more of a personal question. The
Yes,
attendees want
please.
to know if you have an Insta or YouTube handle that they can follow.
I'll tell you honestly, many of them have requested this, and I think now I'll have to take it up seriously. Many of them told me if I have a YouTube channel or if I have a Instagram page where they can follow me. But out of my work and my profession, I'm sorry, like I'm not much open. I mean, I'm not too fond of making reels and videos. But I think I should take this up as a motivation right now, and I will definitely work on it. But you all can follow me at my clinic page, which is Swar. I have a clinic in Goa called as Swai Women's Health and Wellness Center. It's in Panjim. It's on the 18 June Road, very or just bang opposite to Dr. Kedar Phate. People from Goa know Dr. Kedar Phate well. They're just opposite there. It's a center that we have started addressing all the women's issues, and we are a team of four of us. I'm a women's healthcare physiotherapist and a pelvic floor therapist. I have a counselor who deals with all women's health issues like postpartum depression, issues with their husbands, whatever, menopausal issues, whatever. She deals with the counseling. We have a dietitian, dietitian Nikisha Shetye. She handles all because, like I told you, you need to work in it. It's a loop. You can't say, okay, this is my patient. I'm only going to see it. No, when it's a PCOD case, when it is a pregnancy case or whatever, it's a postpartum case. I need a group of or like it's like it is a what do you call it? It's a holistic approach basically. So there is a dietitian, Nikisha Shetty, who's there with us, and there is a lactation expert who also takes the yoga classes. She takes the prenatal yoga. She's Prutha Panandikar. So she does the lactation uh, and helping my mothers out. So as a OBG therapist, even I can do the lactation part, but I know that I think she can do it better than me. So she handles the lactation part for us. So we are like four women who have come together and we've started that clinic. It's Swar. It's there on Instagram. You can follow us. But yes, I think I should take it up seriously and work on my YouTube page now. I'll do it for sure.
Yes.
That's great. Thank you. So the
Hmm.
next question
Yes.
is, after pregnancy, if the baby's weight reaches 2 kgs, does it affect the SI joint dislocation in case there is an SI joint dislocation?
So if it is during the pregnancy, SI joint dislocation during two, first of all, is a little less, it's a little less weight. So I don't think it should affect the SI joint during the pregnancy. But in case the question is about the labor, like while you're laboring and the baby has to, come out or follow, there could be a little discomfort that the mother might feel when she's having a pre-existing SI joint dysfunction. So if there is a mother who is coming to us with SI joint dysfunction, work on the multifidus, work on the obliques, and work a lot on the pelvic openings. Okay, your form closure and basically the form closure exercise and the muscles activated to that. Obliques, multifidus, your longitudinal muscles. Okay, your quadratus lumborum multifidus, your obliques, and your glute muscles. This will help you strengthen the posterior chain, and she'll, of course, it won't recover her 100% because of the dislocation, but at least she'll have a bearable or a pain-free pregnancy out. And once the baby is out, then you can deliver. But if the question is pertaining to the weight of the baby, no, it won't, because there are mothers who have 2.5 kg plus baby and they have delivered safely with the SI joint problem. So the baby is not going to give it's not going to worsen the problem. You will be in pain, but it won't get worse for sure.
Thank you. So the next question is, there's an instrument in the market called Pelvi Ease to measure the pelvic floor
Yeah.
strength. Is it worth buying?
Yeah. I would suggest everyone who's interested in working in the field of pelvic. So this is out of the current discussion. So this pelvic is basically an instrument which is a perineometer. Okay, it's a perineometer, and perineometers are basically used to assess the strength of the pelvic floor. I'll just show. I don't have it right now. It's left back in my clinic, but I'll just show you all how it is. Okay, like for example, this is the probe. It is something like that only. It is a probe. This is a dilator basically I'm showing you all, but imagine this is a perimeter. It's a probe, okay, which is a chamber of pressure. Okay. So the probe is inserted in the vagina and you tell the mother to squeeze and to relax. Okay. So that tool can be used test the strength and can also be used as a therapeutic to use it as a therapy. So that exclusive, that isolated working of the pelvic floor, what question was asked before, you can use the perineometer to activate those exclusive pelvic floor muscles. Okay, so Pelvi is a company which makes perineometers, and if you all are exclusively working in the field of pelvic floor, then I would recommend you to buy it. Okay, that's an Indian-based brand, so the charges are around 6,000 or something, if I'm not wrong. Much cheaper, much better than buying an international perimeter. Okay, and yes, the durability of the product is also good. If there's somebody who is very conscious about the hygiene, you can tell the mothers to, you can get tell the women to buy her own product because it's 5,000, 6,000, and she'll require it for a long time. So you can do that, invest and get her own product, or she can. You can keep one in your clinic as well. It's worth buying, I would say. Yeah, it's a perineometer, so both therapeutic as well as for diagnostic purpose, you can use it.
Thank you. What kind of breathing
Yeah.
exercises are useful in diastasis recti?
The core breathing that I told you all. So when you inhale, you expand. When you exhale, like I told you to squeeze the pelvic floor. When you tend to automatically take your abdominals in, right? So that itself is going to activate the core muscles, the abdominal muscles. That breathing you can do. Okay. Avoid the breathing which is having, the pattern of breathing that you do in yoga, where you, I think it's Kapalbhati, if I'm not wrong, where you flap the tummy. You can avoid that, but all the other forms of yogic breathings you can continue.
Thank you. The next question. What
Yes.
exercises can be done by females with low-lying placenta?
Yes. So, like I told you all, it's a no. If there's a low-lying placenta, it's a contraindication. Avoid exercises which are going to be excessive abduction, sumo squats are a no, absolute no. Any exercise where there is hip abduction happening, pelvic floor stretching, it's absolute no. Low-lying placenta women is a high-risk mother, so you have to see a one-on-one session with her. Not following the protocol of 150 minutes, no. Okay, it has to be a session on the bed. Okay, so anything you can give her the breathing, the core breathing, what I told you, you can give her that. You can teach her activation of the pelvic floor muscles. Okay, you can give her a little of upper body, but everything has to be done in supine, I mean, in supine lying, side lying, or sitting, or all four. But avoid taking her into squats or standing. No, know that, and no excessive weights for sure, because it's going to only worsen her condition.
Thank you. So this is one
Yeah.
a personal question somebody's
Yes,
asking.
please.
She wants to know which college have you done your MPT from?
All right. So my bachelor's and my master's both was from Kelly University, Belgium. I'm really proud and I'm really grateful to pass out from that college because Kelly is a place which gave us, which not only made us perfect in our field, but it also gave us qualities of leadership, how to, it taught us everything. So not only books and clinics, but it gave us everything. So anyone who comes to me recommending, asking for a good college for recommendation, I would definitely vouch for KLE University. It's now called as KAHAR, KLE Academy of Higher Education. Back then when we passed out, it was KLE University. And I did my 4.5 years of bachelor's there. I did my master's, 2 years of master's under Dr. Aarti Maheshwari ma'am. Very good human being, very good guide. Whatever I think I am today is because of my university. But after that, I did my, of course, once you pass out, you always need to enrich and you need to add on different things. So after I passed out, I did my pelvic floor course, I did my labor preparation and support course. So that's like the add-on things that I kept adding to my program. Okay, but my graduation, bachelor's, master's from KIT.
Thank you. That's
Yeah.
very good. The next question is how to assess and treat antenatal low back pain.
Yeah, I think we've already taken it up again. So
Okay.
when first you evaluate the posture, you know which muscles are tight, you know the postural deformity, and you address those muscles. So you address the strengthening of those muscles.
Yes.
Yeah.
The next question is which would you the best pediatric neuro gynec MPT college?
Oh God, that's something you are putting me
Out of
in a big
context.
mess. Yeah, I mean, I don't know what to say, but I would again like be a little partial and say, please go to KL University. But the best college. You have to see the fees, the your transport from home to there. All right. So please Google, please research about it. Go to a place where you have the staff there is with the maximum level of graduation. Like I mean somebody who's done PhD or with staff who's having a lot of years of experience. All right. Or go to choose a college which will give you academics and the clinical exposure both. Okay. Colleges which have hospital attached to it. So you know it's it is where you can focus on academics as well as the clinical part. Go to a college which would have you have a good library setup, a good hostel facility. You need to even check about your mess, your eating. So there are a lot of factors. The fee structure, right? So there are a lot of factors associated with it, and that is how you choose. But yeah, choose a college with a lot of experience. Many people passing out from that place. Not a new college, I would say, if you want to do it in the best form and you're going to shell out so much money, and something where you have staff who is experienced, like who has done their PhDs and who have guided a lot of students.
Thank you. Um,
Yeah.
Next question is, did you do a separate pelvic floor course?
Yes.
And if
Yes.
yes, from
Yeah.
where?
Okay, so the pelvic floor, to add that extra pelvic floor knowledge is that's something that what we learned in MPT was like just to know the pelvic floor and Kegels. That was what we had learned in MPT. Okay, maybe a little bit of exercises here and there, but to dive deeper. Okay, like to understand the pathology of your pelvic floor. Pelvic floor is not just pelvic floor, but pelvic floor has hypertonic problems and hypotonic problems. It is a skeletal muscle, so it can get tight or it can get even loose. Okay, so how to address both this is another vertical totally. It's not only OBS, but it's like another branch entirely. So you will have to do that extra course. I did my basic course from IPRI, which is in Ahmedabad. That's International Institute of Pelvic Floor Rehab and Research. And that was my basic course that I did from Dr. Hed Desai sir. I was the first batch of workshop that we did. It was an intensive program that we had started. I even worked with them as a clinical coordinator for a few years, and then I did my other short courses from your. There was one short course that I did with Dr. Ashwini Kale as well. Okay, so that was also a very good add-on to my profession, which helped me with her. So Dr. Ashwini Kale is somebody who is doing urodynamics in pelvic floor. So a third vertical which is popping out. So she's also very good. So I did my another short course with her. So these two courses were good enough for me to, and seeing patients every day was good enough for me to, progress and go ahead.
Thank you. The next question
Yeah.
is, do you have any knowledge about an online course for 1 to 3 months or an offline for antenatal exercises?
I would suggest rather than doing an online course for 3 months or something, the best thing is to do since you're spending so much money. I would advise you all, go and attend it in person. Okay, do something which you can attend in person. All right, like there are a lot of courses which are there. If you want to check about the international courses, there are EPTA based courses which they come once a year. Okay, they've just finished one of their course in last year, I think November or December, they finished the APTA course where they addressed obstetrics. It was like a 3 days or 4 days workshop that was done in Bangalore, where they addressed obstetrics, postpartum, labor, and even they addressed some issues of high risk pregnancy. Okay, so doing this APTA based international workshops is also a good idea. Of course, the fees are a little on the higher side. Okay, but coming to Indian setups, I would suggest you all to do something which is in person rather than doing online. Okay, because in person you understand the technique better, you understand the positioning better. Right now only we saw there's so much issues. I tried my best to show you all, but there's so much issues with the placement of the camera, this, that. Okay, so it's better to always do it in person. In India also there are multiple people who are doing courses. Do a course and avoid a workshop is what my suggestion would be. That's what I even tell all my students. Avoid doing a 1 or 2 days workshop. Do a course which will certify you as a therapist or as a antenatal specialist or whatever, rather than doing a 1 or 2 days workshop, which is just going to add those contact hours. All right. So do a course, spend your money and get a certification. Then just keep doing that then just adding that certificate to your folder.
Dr. Rashmi, I think we'll end the session. It's
Yes.
gone quite a long. It
Right.
shows
We
how
like
nice
2 hours.
the session was, but I think we are short on time.
Yes, yes.
Yeah.
How
Dr.
many more questions are we left? Probably you can just message it to me. I can
We
answer.
have
Okay.
quite a few questions. I
Okay.
can send it to them, but I don't know
Yes.
how do we put it. So what we can do is on the YouTube channel, we can
Right.
put the question and the answer. So I'll put all the questions to her, and you
Yeah.
can check
I'll
our
answer it.
YouTube
Yes,
link
I
is
do.
there, and you can
Yes.
check in that. We will make sure that all the questions are answered. Okay.
Perfect. Perfect. Yes. And y'all can get in touch with me even on my Instagram, or I can, if required, I'll share my number with you all. You all can just get in touch with me on the number. So we are here not only for this 1 or 2 hours, but we are here from now on. So you can definitely get in touch with me for any concerns related to the patients or anything. But thank you so much for your attendance. I can still see around like some 28 to 30 people still engaged. So that's very nice of you all to spend your Sunday with listening to me. So I would have really loved to answer all that, but it's been like 2 hours. So I think we're taking
Yeah,
like
we'll
two
go ahead.
sessions of
So those who need the
so
Instagram handles, I will be taking her Instagram handle and putting it
yes,
on our YouTube channel. On the
right,
chat
right,
of the YouTube, you can see that particular thing because this Zoom
perfect.
meeting will end, right? Dr. Pooja, can you please do the vote of thanks for us?
Hello.
Yes,
We
Pooja.
can hear you.
Okay. So, on behalf of everyone present, I sincerely thank Dr. Sudhini Borkar for conducting such an informative and helpful webinar on exercises during pregnancy. Your expert guidance and practical demonstration have truly empowered expectant mothers and mothers to be in future to stay active and healthy in a safe manner. We deeply appreciate your time, effort, and valuable insights. Thank you once again for an enlightening session. I would also like to thank all the participants for their time, interest, and an active involvement in today's presentation. Last, but the most important, a special thanks to our committee head and guide, Dr. Ruchi ma'am and Dr. Sanjeev sir for this platform. With this, we conclude today's session. Thank you everyone for being a part.
Thank you so much. Once again, I would like to extend my thanks to IAP Women's Cell Goa, Dr. Smarnika, Dr. Pooja, who've been coordinating with me, since a month. So thank you so much for this lovely opportunity. And yes, looking forward for many more. Yes.
Pleasure is ours. And with that, thank you all the attendees for giving your time on this Sunday morning, being Shivratri. With
Yes.
that, we end this session right now. Thank you all.
Thank you so much.